Currently, 55 schools in Toronto have at least one reported case of COVID-19, and 12 of those institutions have declared outbreaks, one as recently as this morning. So what exactly must students, staff and health officials do when there's an outbreak? We asked Toronto's Associate Medical Officer of Health.
An outbreak is defined as having 2 or more people in the school setting who test positive within 14 days, where one person could have possibly given COVID to another person.
If even a single case is detected among students, the school principal will dismiss the cohorts that the student is part of, including their school bus and extracurricular cohorts.
The cohort will isolate for 10 days if there are students in the cohort who are fully vaccinated. So, for example, in a high school, they can still go to school as long as they don't have symptoms.
Unvaccinated students are required to isolate at home and watch for symptoms. Public Health says all students should take an at-home PCR test right away and again after 7 days.
Toronto Public Health will send a letter specifically telling the class, for example, these are the dates, this is when we recommend you get tested, and this is when you can be cleared from self-isolation.
As for COVID-6 staff members, every cohort they had contact with could be asked to isolate depending on what Toronto Public Health finds out during their full investigation, which involves determining
what symptoms does the person have? Who do they live with? What did they do in the last 14 days? Where could they have gotten COVID? Do they know anyone that had COVID?
Then Public Health will investigate who could have been exposed to the staff member from the beginning of their contagious period, which is 2 days before the symptoms start. Dr. Dubey stresses that all these procedures are followed even when a single case is detected, regardless of an outbreak being declared. TDSB spokesperson Ryan Bird says schools take their lead from public health, but not much changes at the school.
Typically, when an outbreak is declared, there are no additional steps that need to be taken. And that's just because we already have stringent health and safety measures in place at school, whether it be physical distancing, masking, the use of HEPA filters in classrooms.
Dr. Dubey adds the safety measures and the investigations have been successful in controlling widespread infections in schools.
If there is an outbreak that is declared in the school, sometimes it's just within the one classroom that there has been spread within a classroom. It does not always mean that the whole school has a large outbreak.
Typically, you will see school life continue as normal in the school, despite the fact that an outbreak has been declared.
Now, Dr. Dubey says since school started back in September, on average, an outbreak is just 3 cases. For more on this story, you can go to our website, toronto.citynews.ca. For City News, I'm Dilshad Burman.